important topic and really conscious that it's day 4 of Cannes and it's absolutely boiling outside. So thank you all for joining. I'd like to introduce my panelists. Wait, just give us one. We're being recorded. My amazing panelists who have flown in to be with us today to talk about this really important topic. Like I said, scaling health equity through innovation. So firstly, I'll just quickly introduce myself. My name is Katie Langdon. I run a healthcare communication agency out of the UK. And we exist to make sure nobody feels lost in healthcare. And obviously that includes in making healthcare accessible and meaningful, the communications for all. And health equity very much comes into our everyday. So I'd be delighted to introduce the panelists. I wonder if you can introduce yourselves and then also just say what you think health equity means to you.
Hi everyone, my name is Cecilia Garwal. I'm the marketing director for maternal and child health at Massimo. Massimo makes pulse oximeters, you know, those little red lights on your fingers or on a baby's foot when it's born. And I'm initially an engineer, not at all a marketeer, and I was very frustrated as an engineer, especially in my very first job, which happened to be in Ahmedabad, India, that people make great inventions, but if it doesn't reach the right person, if then people don't use these innovations, it's basically useless. And that's when I decided to move to marketing and then move into healthcare marketing specifically to make sure that we can improve patients' lives and their families, the impact it has on their families as well. So for me, health equity is making sure that we improve outcomes regardless of the age, the skin pigmentation, the gender, socioeconomical status of a person.
That's great. Thank you for sharing.
I'll start with what health equity before I introduce myself. So for me, health equity is not equality of services. It is equality of opportunities. So I'm Dr. Vatsalya Vasu from the practice vision, The Art of Reengineering. A bit of a background on what I do. I wanted to be an engineer. All right. So, but yeah, I ended up being doing engineering with human brains. So that's what I do. So I sit behind the data, understanding the human behind the data, and I also try to understand what's the human behavior in front of the innovation. So the art of re-engineering, we actually breach and understand human behavior. So every innovation, every technology that comes into place, here I am. On the side, I'm the co-creator of Neuroregenesis Framework, which is about regenerative leadership index, understanding how leaders think, decide, and change the world. On the other hand, I'm also I'm also the published author and a co-creator for primary healthcare, co-owner for primary healthcare medical clinics in Australia.
Wow, fantastic. Thank you both for being here. Cecile, I'd like to start with you. So as innovation continues to transform healthcare, what opportunities do you see for making health outcomes more equitable across communities?
So, as you said, equity is not equality. We want to make sure everyone gets the right treatment and gets the best outcome they can have. And that comes first from breaking barriers to access the innovation. That's also the role of marketing, but that's the role of how you design the product to make sure people benefit from it and it's right for their use. That's first thing. Second thing I see as an opportunity is enabling more human care. In the morning, there was a lot of things about the human touch, the human soul in this world of AI. And I think that's very important that innovation just enables people to talk to each other, to understand each other, and hence treat better the patients that we have in our hands.
Yeah, and everything's moving so fast at the moment, isn't it? And I think that is a really important consideration with how we make sure that the human doesn't get left behind. Do you agree with that?
Yes, we shouldn't just be data points. So it's very tempting, especially in the work I'm in, which is patient monitoring, to then see humans as just a bunch of data. Oh, your blood pressure is this, your pulse rate is this, and then you're just numbers. Yeah. And I think true innovation will have the numbers support what decisions the doctors are going to make so that you come to the right solutions for each of these patients, regardless of which community they are from.
Yeah, absolutely. So you kind of touched on it, but it'd be really interesting to move over to you now, Celia. And from your perspective, what are the biggest barriers preventing health equality today?
I think Cecil just mentioned about access, right? So the biggest misconception about innovation and technology and, in healthcare and health equity, I would say is the access. Access matters, but what matters is the human behavior behind those access. So I distinctly think that there's about 3 to 4 barriers that I would love to talk about. And one of the key barrier would be fragmented services. The healthcare, the policies, the communities that are coming together. That is one of them. And the other one would be the behavioral barriers. And when I say behavioral barriers is how this access are, given and who are the end users, right? We all tend to assume that every patient is walking into the door can make rational decision over what we are providing in terms of services. But what kind of education, what kind of advocacy are we doing from the innovation side or from the people side? I think that is the gap that we need to look into. So that is another barrier. So it's about the human brains and how we trust the system, because without the trust, there is no adoption of the system. So that would be one. And the third one, I would think, and it's across, it's the societal, the social economic perspective. So before healthcare is seen in the clinic, it's long decided what it is, right? Before practitioners see them, right? And that changes across different social economic backgrounds. So sometimes what I've seen, and it's being in the primary healthcare sector, we do have very, very diverse group of people coming from the rural, the regional, and of course the city centers. And every one of them actually deciphers healthcare in a very different way, right? So, and it's all goes down back to the socio-economic background they come from. So coming back to equality, so the equality of services is not the factor, it's about the equality of opportunities they are given. And the final one is this leadership short-termism. I would say short-termism is a lot of the leaders, which is whether practitioners or even scientists who's coming up with this technology or innovation, they're fantastic. But what's happening is everyone is looking at the symptoms, and preventive healthcare is missing the point, and that's a missing link. And when you say preventive healthcare, we talk about the behavioral aspect of it, and that is a missing link. So, yeah.
So basically it's coming from many different sides.
Yep.
And the silos that we're seeing in the healthcare system are, well, they've been around for years.
Absolutely. They tend to all run parallel. Okay. And I think the biggest challenge is the partnership. And that's when you talk about partnership, people talk about competition. So putting profits aside, putting everything aside, putting the human element in front, I think that's a very important aspect of why the fragmented system is still fragmented.
Yeah, absolutely. So it's putting the human at the center and then meeting them where they are.
Absolutely.
And that could be in all kinds of different places depending on how they are around a health education and where they come to the situation.
It's true. Yep.
Interesting. So I guess then over to you, Cecile. How can healthcare organizations balance technology, accessibility, and human-centered care while scaling impact?
Scaling impact in healthcare would mean potentially treating more people or identifying or preventing more diseases or malformations, things like this. So how do we make sure that we can reach more of the people? I'll start with an example. In maternal and child care, which is the area I work on. In many communities across the world, it's extremely common to do skin-to-skin as soon as a baby is born. And that has shown over the past decades really great outcomes for the mother as well as for the child in their vital signs and so on. And it's a practice that has been there for thousands of years. Yes. In the Western world, we tend to forget that as everything became medicalized and as innovation took over human care. Yeah. And as I said, as people became numbers and you had to get the right data. What we see with innovation today is that we are able to bridge all this. So in my company, we have launched now wireless sensors. Amazing. It sounds very simple. Okay, we are in 2026, everything should be wireless, right? In the medical world and in a hospital setting, it can be very tricky because C-suites may be looking at the cost of it and saying, oh, you know, I need to have the Wi-Fi, I need to have this. Yeah. It's going to be very complex. Cables are great, but cables then don't look at the end user, the nurses. Yeah. Cables are a barrier to the adoption of certain screening or certain policies that different agencies are putting, because they will slow down the care. They put a barrier between the different humans, between the mother and the child. Absolutely. When you put a wireless sensor, you're allowing the mother and the child to bond without being disturbed. The doctors can stay outside the room, the nurses, the midwives can stay outside the room, look at the data on their own screen, and all of a sudden you really put the human perspective at the center. You know, like what matters truly is that the baby and the mom is fine. Yeah. Data is there, great, but at least they are in a quiet environment, undisturbed. And then you get the output of that, not just in the outcomes, because you get better health for the baby, but also for the cost for the hospital. You detect diseases immediately because the baby has the sensor right from birth, so you can detect birth defect, heart defect, and so on. And I think that's a really brilliant thing that we can do with simple innovation. It doesn't need to be very fancy. Yeah. We also see AI coming into our world, you know, in healthcare. And I think there is big threat as well for AI. So there is the opportunity to see predictive medicine. In the morning, there was a talk about algorithm, you know, predicting things. It's great. We work a lot on that. But it's also how do we ensure that there won't be bias that the AI carries forward because of hundreds of years of research being done just on men, for example. Yeah. There was a publication just a few weeks ago, there are dozens of them over the last few years, on the bias of gender within medical AI. You know, that will tell you, go to the emergency room if you're a male, but will tell you, book an appointment if you're a female.
Wow.
And that is an issue, and policies and partnerships and innovators really need to work hand in hand to make sure we don't carry forward this history.
That's great. So what we're saying here, with using the example specifically, is we've got this amazing technology that allows mother and baby to wirelessly be together in the very early stages of life for the baby. So let's think about that in terms of access. And Celia, do you have anything to comment on this example as to how that works with getting people the access that they need?
I think access, as I mentioned, it is important. But how do we get there? It's, again, back to education, right? And culture. So culture is built based on repeated behaviors and what leaders would like to do or should do, right? So if you're talking about, you know, how Cecile mentioned how the Western culture, they've tried to break away that idea of, you know, skin to skin. And that's also because we have modernized. Yes, we have scaled, but then the human element is missing. And that's a classic example why human behaviors are always the missing link, right? So in terms of access, anything that comes down from innovation or technology, amazing, you know, business policies are there to scale the business and bring in the profits. But if you want to create an impact, it has to be from the human side of it. And that creates the excess, right? So from the human side would be, how do I build the right culture? And building the right culture is repeated behaviors, as I mentioned. And that repeated behavior has to come back to, again, the education. What are we trying to achieve? What is the outcome? So I've mentioned this in many of my talks, that we are not stuck. We are patterned, right? Yeah. We are patterned in a way that what works, what is familiar, what is certain. We are not built, in fact, human designs, we are not built to deal with transformation. We're built to pick up threats and fears. So if anything along those lines actually stops the access to the healthcare sector. So coming back again, so if you want to have a better outcome, a better impact, then you have to go back and break the very pattern that created that chaos.
What do you think is the best way to do that? I mean, obviously there are much longer term things we can think of. For example, you've already mentioned the lack of women being included in clinical trials and examples like that, which are great, but they are long-term goals to overcome. Do you have any advice for things that we can do in the everyday to help people?
I think we should firstly identify that though we are working in parallel, we need to be working in partnership. I'm just going to piggyback what she said just now. We need to work in partnership, and to work in partnership is making sure that everyone is involved at every layer of innovation, at every layer. So it's beautiful that everyone in the technology sector or the innovation sector has got an idea and then they go all out developing a technology, but dropping off the human touch to it, the human behavior and how they're going to receive it. So most of the time, researchers have picked up, they tend to steer towards a certain human behavior so that that product gets to go out in the market as soon as possible, because the longer it's in research, the more money is in. So apart from just looking at that, they should start looking at, okay, it's not just the profits, but I'm looking at the long-term reward and not the short-term extraction. So the short-term extraction comes back again is, I need to bring this A amount of money back into the business if I want to get the best out of it. But instead of looking at that, look at what's the long term, what is the reach in terms of communities, what's the reach in terms of preventive healthcare rather than being symptomatic or reactive healthcare.
And do you see that being on a government level, or do you think that's the responsibility of everybody that works in health?
That's a very interesting question, because none of this can actually achieve on its own.
No.
None of it can be achieved on its own. You need everyone working hand in hand, whether it's policies, yes, innovations, is good. It's technology. It brings us to the advancement on how we can do it. Businesses scales them. But then if you don't work hand in hand, then with the human element in it, how are we going to scale it?
Yeah.
So we can't work in silos, and that's a real definite. And that's where I said partnership is such a key element to it. Yeah.
Just to react to this, if I may, as the industry, we have a very dual behavior, here. On the one hand, we do want to push for our innovation because we are not a non-profit organization, right? We're there to make money. But on the other hand, we have a mission. We have a passion for our work. We want to save people's lives. Yeah. And we also ought to push governments or other policymakers, scientific societies, to tell them, well, now this is possible. You've been talking about this or that for years, that you would love to be able to measure this, or you would love to be able to, there we are, now we are at it, so now help us. Yeah. And it's very difficult as the industry because they can be seeing us as, oh, well, you're just pushing because you want the profit from it, yeah, right? Absolutely. And part of it is true, but at the same time, well, we are there to change the world and make sure that tomorrow is a better place for everyone. Yeah.
I would definitely agree with Cecile. So Cecile and myself, as much as we're so different in our industry, we are very complementary, right? So that gap, if people can identify, that policy is our way towards sustainable change. Yeah. So whether it's at a government level, whether it's at that very infancy stage of innovation, the fact that we identify the gap between innovation and scaling is, identifying how are we complementary versus is there a competition towards it. See, the moment which we by default, it's a human nature, we default into looking into the competition, which is the fear. Okay, if I'm going to go into this space, an uncertain space, what's in for me? And if we can default back or break that pattern and ask ourselves this question, we need to create policies for good change. So when that happens, we will start becoming innovative with our process rather than just going with what we have been patterned to do so. So yep, as we see lots of differences in our industries, but finding the complementary part is got to do a lot to do with the policies and egos that comes into play. Yeah.
Absolutely. And we touched on it earlier, but do you think this is more of an opportunity in prevention rather than treatment, or do you think it's an equal opportunity? 'Cause it feels to me that it's always been very easy to prove that treating somebody has an outcome. And I think you said it earlier that preventing somebody is almost you're preventing the unknown, the invisible, the what if.
I think it's both, but both are not measured equally.
Yeah.
If you're preventing something, you're not going to get an ROI because the person is never going to fall sick or is not going to have long-term sickness. If you take a baby that has a heart issue and you treat it very early in life, you're not going to have to carry 30 years of medical care and so on. There's a cost associated to that, but it's tough to measure. There are some great specialists who are able to do this. Whereas on the other hand, treating is very easy to calculate. It's like, this is the cost of your treatment, whether it's in medical equipment or drugs or whatsoever. And C-suites in hospitals like numbers. Even though you run a clinic or a hospital and your goal is patient well-being and improving outcomes, it's also making sure you're financially stable. And cost of care come into play. So to answer your question, I would say it's both on the prevention and on the treatment aspect. And we need to work on both things because in monitoring, when you have AI, you do enable prediction. We are now putting, algorithm that tells you, oh, this person is going to deteriorate very soon. Do monitor this person better. Watch out, something bad is going to happen. You can predict that. That's great. But it's also about just keep monitoring and keeping an eye and making sure that, okay, the treatment is working. Whatever we've done, whatever surgery has been performed on this patient, now the patient is actually doing well and recovering well. So, yeah, both of them. Yeah.
I would definitely second to that. Working hand in hand, if you're just working towards treating a patient versus preventive and just focus on probably 80% on just treating and 20% on preventive, inevitably you would start building invisible cost into preventive medicine. So over time, the policies that has been focused on just treating will eventually fail because we have not balanced it out here.
Yeah, fascinating. Thank you both for that. So we've talked a lot about silos and the need to work together. How can stronger collaborations across life sciences, business, and policy accelerate more inclusive healthcare solutions? I'd like to come to you first, please.
So how silos can actually...
Yeah, like how can stronger collaboration across across all the different silos come together to accelerate inclusive healthcare solutions?
I think first thing is to break away the barriers of egos that comes into play. every businesses, every government, it's very geopolitical sometimes. It's driven at different, based on different climates, I would say. At one point in time, it could be just the cost for the country. And then another reason why something comes into play is probably for geopolitical reasons, where I want to be popular, and they bring that in. So breaking those silos is it ultimately comes back to what is it that you want in terms of impact. So the purpose. How do you lead with purpose and transform with passion is an important factor. So if your purpose is about money, then you might be just self-focused, right? And you would not want to partnership. And I don't think in this current era, and we keep evolving, but of course with AI that's coming into play and how it's partnering us, I don't think we are in a world where we can work independently anymore. We should start having a mindset shift needs to happen, that we are collaborative and we will be collaborative. If we are collaborating with AI, why can't we collaborate with another human being?
Sure.
Yeah.
Yes, it's such a good point, isn't it? It's basically back to,
They're very humankind.
yeah, human skills.
And the human touch,
Yeah.
the skin to skin. So
Yeah.
so it all comes back to the human behavior, right? What is it that we want?
Yeah.
So if you understand your purpose, automatically, somebody said this in the previous panel, if you understand the purpose, the profits will just come.
Yeah.
Right. So, but if your short-term focus is about extraction, forget about your long-term purpose, which is rewards. Yeah.
Agreed. I personally believe that it's more important than ever to lean into human skills, communication, good leadership, and to almost go back to basics in some ways and just remember what works and how to treat each other well.
I just want to add on this. It's where innovation will truly empower humans. You know, it's gonna make it possible to free time. You know, you're not gonna be looking at screens and data and trying to interpret it anymore as innovation comes into play. Now you can really focus on what does it mean, what do I do, can I really understand my patient, what is it saying, and so on. So, yeah.
That's great. I think just being conscious of time, I think we're coming to an end. I just wondered if there was anything that you wanted to leave us with. From my perspective, the themes that have come out are very much looking back to the human that we are caring for, how they come to the almost to the healthcare solution with the knowledge that they have, the education that they need. And then on the flip side, it's also about partnership within the healthcare system, not working in silos, really trying to collaborate, but also push policy now that we have more innovation and the innovation is moving at pace. It's kind of how do we keep up is probably what I'll think about after this panel. But I don't know if either of you would like to kind of add a closing comment or something that you think is the most important takeaway.
Technology is never going to replace humans. I think we discussed that enough in this panel. It's going to amplify what we can do, and we need to be the watchmen also of that not taking over humans. It amplifies us, does not replace us, but it does not push us down to then, you know, being dependent on it. I think it will be a success when we make sure that the technology serves a purpose, to take back your word on purpose.
Great.
I totally would agree, but as I would like to sum it up by just saying, you know, innovation scales whatever that we want, enhances everything in terms of, you know, health equity. But going back, it's the human touch, human behavior that actually will create the impact. So we need to just understand that element. So as much as we have lots of technology in place, without the human element of integrating this technology and, you know, deciphering what's next, then yeah, that's the missing piece.
So to kind of sum it all up, it's definitely always needing a human in the loop, being driven by technology to see what we can achieve and how we can make change, but always remembering that the humans will push us further. Yes. Fantastic. Thank you both so much for joining us.
Thank you, Katie. Thank you for having us.
Brilliant panelists, and thank you everyone for coming.
Thank you, everyone.
Thank you.